Somewhere, in the vast labyrinthine walls of the Foundation, a folder is being misplaced. A backup is corrupting. A budget is getting slashed. A low-priority anomaly is disappearing overnight. A set-it-and-forget-it policy is becoming good enough because it has to be. Who takes note of these things? Who commits them to memory? This is the Lost SCP series. Item Number: SCP-L999. Object Class: Euclid. Special Containment Procedures: due to the specific conditions required to reproduce SCP-L99, spontaneous civilian discovery is considered unlikely. Nonetheless, Foundation web crawlers are to search for any publications referencing cranial valve implantation. Individuals possessing knowledge of SCP-L999 are to be amnesticized. Description: SCP-L999 is a phenomenon in which the surgical implantation of an industrial gate valve into the human cranium, and subsequent rotation, displaces the subject along the fourth spatial dimension. The means by which SCP-L999 was originally discovered, along with the records of how the Foundation gained this information, have been lost. SCP-L999 Testing. The implications of reliable fourth-dimensional displacement in biological subjects prompted the authorization of formal testing. Implantation Testing. Implantation requires removal of a circular section of the cranium to accommodate the valve stem, which must be anchored directly into the exposed cavity. The valve body is seated flush against the exterior of the skull, with surrounding tissue closed around the base. The following sites were tested for viability. Location: temporal bone. Result: anchoring caused surrounding bone to splinter inward during torquing, driving fragments into the temporal lobe and middle meningeal artery. Subject died of intracranial bleeding within minutes. Location: parietal bone. Result: implantation held during procedure but failed to bond with the stem. Valve loosened post-surgery, tearing the underlying dura mater. Subject expired within 48 hours. Location: frontal bone. Result: immediate subject death. Location: occipital bone. Result: implantation successful. Retesting of previous implantation sites is pending. Test L999-01. Activation Testing. Location: Site 149. Testing Chamber 7. Date: June 26, 2006. Subject: L999-A4. Subject was positioned standing in the center of the testing chamber. A Foundation researcher was assigned to rotate the valve clockwise. A second researcher was stationed to observe and document the following: visible displacement of the subject along an unobservable axis, perceptual distortion of the subject's physical form during traversal, any verbal response from the subject during activation. Test duration: approximately 1 second. Result: success. Recorded observations. Upon rotation, the subject was successfully displaced along the fourth axis. Observers reported the subject twisting and elongating, followed by an inversion which exposed its skin and internal structures simultaneously. Portions of the subject passed beyond observable space and did not return. Displacement ceased before completion. The subject came apart across the floor of the chamber, with the resultant debris no longer identifiable as human. Thank you all for watching, and a special thanks to all my patrons, especially my level 5 patron, Inkbound Scholar. If you'd like to support the channel, please consider checking out my Patreon to gain early access to videos, the ability to vote on what videos I make next, along with numerous other Patreon benefits.